All right, this is Gilda's Club Kansas City, and I'm Clara Saint, our program director, and I'm going to turn it over to Mike Cartwright for our Unleashing Your Potential with Chiropractic Care class. Go ahead, Mike.
All right. Well, I just want to welcome everybody. I did call it Unleashing Your Potential with Chiropractic Care. I hope that you will understand why I call that later as we go along. So I do want to kind of introduce myself, if I can get this to work. Hold on. Whoop, there, it took off on me. Hold on. Okay, well, I just want to introduce myself. I am a chiropractor. I am a graduate of Cleveland University, Kansas City, and I currently work for Cleveland. I'm a clinical instructor, which means I do teach classes at the university, but I also oversee interns in the clinic as they get ready to prepare to go into practice. I'm also the community outreach for the university. On a personal level, I'm married. Together, my wife and I have 7 kids, and we will have our 16th grandchild this August. So pretty exciting. Little background why I feel kind of really excited and like to be involved with the Gilda's Club. I lost both my parents to cancer. My dad passed away when I was 16. He was 51 from leukemia, and my mom lived to 63 and passed away. So I'm very familiar with some of that takes place. So I want to talk a little bit about Cleveland. I don't know if you guys are aware of it, but Cleveland is was a chiropractic college here in Kansas City, and in 2 years will be 100 years old. We started 1922, and we are still run by a Cleveland. Dr. Carl Cleveland III is our president. His grandfather and grandmother started the university. So we did move over into the Overland Park when they bought 34 acres and built the new university. Some of you may have seen that facility. That's where our health center is and the university is. But back in 2015, we changed from Cleveland Chiropractic College to Cleveland University. And then we started adding some other programs. So you may have other people that you know of that will come through Cleveland that are not chiropractors. Still, the majority are chiropractors. We do have an occupational therapy associate program and a radiology associate program that has actually done very well and is up and running. So I just want to put this out here. My potential doesn't matter. Not to offend you, because potential does not matter. It's realized potential that matters. So what I want to do is I want to talk about how we as individuals, as people, we're all in this together, but how do we make our own potential or realize our potential that we have? So where do we want to go? Here we are, 2020. Nobody would have guessed this. 5 years from now, if somebody says, where do you want to be 5 years from now? I think we'd all been wrong where we are going into 2021. But the reason I put a plane in there is because when you fly in a plane, you get on a plane and they start to taxi away, and the airline attendant gets up and they start doing their safety checks and all of that. And then they start going through their instructions on how to put on a seatbelt, which I hope most of us have figured out by now. But then they talk about, in the unlikely event that we have a cabin pressure change, there will be 4 masks that drop down from overhead. What do they tell you to do next? Well, they tell you to put your mask on first. They tell you you need to take care of yourself first before you can take care of other people. Often we become guilty because we start taking care of ourselves, or because we do things for ourselves, but we cannot serve others unless we take care of ourselves. And it's not selfish to take care of ourselves and be taking care of us. I want to ask you a question. If when you turned 16, you were told that you will get any car, doesn't matter, cost, whatever, you can even have somebody build your own car for you, you get that one car, and here's the caveat, it's the only car you get. for the rest of your life. You cannot ride with anybody else, and nobody can ride with you. So it's your only way to get around. So what would you do with that car? You would do everything you can to keep that car healthy and strong and moving. And if there's an issue with it, you would address it and get it taken care of. Well, that's what we talk about, or I talk about. We want to talk about, because that's us. We only get one body. We only get one life. We only get one, and things that break down or happen, we want to have the right attitude to get them better, to move them forward, to get those things. So I want to talk about this. Where do you want to go? Now, this is hard to do in this type of format, because in a live format, I would actually be wanting to know some of the places that you want to go. Sometimes it's as simple for somebody, it's little steps. We want to get there, but have you thought about really where do you want to be? What do you want to do and where you want to go? And then what's the barriers? What's keeping us from getting there? What are those things that are getting in the way? And we're going to talk about health, and we're going to tie it into chiropractic, but chiropractic is not just one thing. Chiropractic is about health and the healing process. So, how much are you worth? Can we put a number on it? Is it possible to put an amount on somebody's worth? Well, you know, I don't think so. I think insurance companies may try to do those, but how much are you worth? What is your health worth? When it's not there, what is it worth? What is it worth getting it back? What do we need to do? Do we have that? And it's not really about money. What about memories? How important it is to protect your brain and your memories and health and those things. Have we talked about what those are worth? And what's your family worth? What are we willing to do? Many of us willing to sacrifice ourselves for our families. That's where we go back to. You have to take care of yourself so that you can benefit your family also. So what are we going to talk about today? Well, we're going to talk about health. And in this environment, I'm sure you guys have had lots of different talks and things like that, but I want to talk about it maybe from a different perspective a little bit. Talk about goals, specifically health goals, or where people want to be, those kind of goals. And no one can truly give you goals. They can help guide you, but those goals have to be yours. And how do you measure it? And if you've lost your health, what is it we need to do to get it back? What is that process we need to get it back? We all go through different things that we lose and get it back. And can we get it back? And then finally, while we're here, we're going to talk about what is chiropractic. A lot of people have a perception of chiropractic, or maybe want to expand a little bit, and how this measures into some of maybe your other goals, maybe your other health goals that you look forward to. And sometimes we will actually talk about, I've talked about Cleveland and maybe some of the tools that we have that we can offer you. So this one is hard for me because I like to see people's reactions when I tell them this secret. And I'm sure there are people going to be sitting there and they're going to be ready to argue with me about this, but I'm going to give you a secret. Healthcare is cheap. Healthcare is cheap. And most people are going, no, have you seen my insurance premiums? Have you seen my healthcare? Healthcare is cheap. It's actually sick care that's expensive. So what I want to talk about, yeah, we are sick or whatever, but how do we get healthy? How do we take that? And is it worth investing? What's the difference in healthcare and sick care? So if we approach healthcare as an investment, health is an investment, it's not an expense until we lose it. And then it becomes an expense. When we lose it, we do what we need to do to get it back. And at that point, we need to continue to invest in it. So you've probably seen this or heard this. A person will normally spend very little to keep their health. Well, we'll give everything or gain everything to get it back. I think that's pretty self-evident, but we will. Lots of times we go about our daily whatever until something's missing or something's gone, and then we need to do it. That's where these goals are going to come back. We're going to talk about how we can tap that back in and make it beneficial. So first off, what is health? We have lots of definitions of health, and I want to kind of narrow it down or maybe even expand it. But health is different for different people. But where does it come from? Where does true health come from? But if you can't define it, how do you know where it comes from? So we're going to kind of define what is health. And if we lose it, if we lose our health, what is it? How do we get it back? Where do we go to get this back and truly health? We'll go from a surviving an illness or something to getting our health back and moving forward from that process. And then once we get it, how do we keep it? How do we keep investing in our health rather than going from illness to sickness to illness and back and being reactionary, being more proactive about our health? And what does it cost? What does it cost? Well, we talked about how much is your health worth? If you lose it, it becomes a lot more expensive, but how much are things worth? I've had people tell me lots of different amounts. I had a person that told me I can tell you how much a heart transplant is because they had a son that had a heart transplant, or they had their ankle reconstructed, and but really was it the cost? It was over $1 million that they'd spent for this particular person for their heart. And was it worth it? I'm sure it was absolutely worth it. So what is health? This is one definition. I really like this because it kind of encompasses a little more than what we typically think of. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Most of the time, people base their health on whether they have a symptom or not have a symptom. They wait until that's how they're doing. Do I feel good or I don't feel good? Am I healthy or not healthy? Let me ask you a question. Our health is not about the weight you lose, but the life you gain. So if you think about it, gaining your health is really not just about, oh, I feel good or I don't have symptoms, but it's about what am I living for? What am I going for? What is it that I gain by being healthy? What is the life that I've added to myself through this health that I have? So I want to tell you some facts. You can record this. You don't have to write this down. Facts. Everything we think, breathe, eat, and drink has an effect. Everything we think, breathe, eat, and drink has an effect. Most of the time, we don't even know it. We don't think about, oh, what am I breathing in or breathing out? Am I breathing deep enough? Am I getting enough oxygen? What am I eating? Those kind of things until we have an issue. Most of the time, we're not thinking about what our body's doing. And what we don't know can hurt us. If we're not aware of what's happening over time until we become symptom-based or think about those pains and things like that, then we don't even know that there's some issues. So going back again to health investment, moving towards the investing in your health. And we need to change it if needed. That's the best part about us, is if we need to change things, we can make a decision to change and go a different direction. We can change things. We have the power to change directions that we're in. So where does health come from? Well, the only place that it can come from, it comes from inside. Our body is doing everything. All those things that we talked about, the facts, all of those are affecting what happens to us, and our health comes from inside of us. Our body needs to be able to be healthy to function well, and that's where health is. So, question, do you think you should go to the doctor only when you have symptoms? Well, answer, most of us, that's when we do go to the doctor or to the dentist or something like that. But truthfully, we should actually go to make sure things are on the right track, even if we're not feeling symptoms. Many times symptoms are the last result of something that's progressed for a long time. So if we are actually getting in front, we want to get healthy, we want to do those things, those measures, we want to get there and measure that. So no, we shouldn't wait until we have symptoms before we go to the doctor and find out where everything's going right. So there was a person one time that told me, if you want to be rich, find a rich person and do what they do, or have them mentor you to get to that point. The three things, so if you want to be healthy, find what healthy people are doing and do those things. So I've narrowed it down to the 3 things that healthy people do. 1, they move well. And what do I mean by moving well? Yeah, that's exercise and your body moving, but what else is moving well in our body? Is our blood moving well? Our nervous communication well? Are hormones functioning well? Are those things moving well so that we're able to function? Is our immune system moving well? The other thing healthy people do is they eat well. We look at, and you guys were talking a little bit about your diet for chemo diet and that kind of stuff, but eating well as you try to get healthier, making sure those things you put in your body can be used, and you're putting those things in your body that your body needs to repair, grow, and strengthen itself. There's a lot of things that we need in our body that we lack. You know, the term vitamin means that our body doesn't produce them. We need to add them. They have to be in our diet so our body can use those things. The third thing, and if we don't do this one, this is probably the one we need to work on the most. I know I do, but if we work on this one, if we get this one right, the other 2 become easier. And this is think well. Taking conscious thought processes, taking control of how we think will help us with these other things. It's not always easy. It is not always easy. The news, neighbors, friends, sometimes there's so much negativity that it's not always easy to think well. But once you gain that, and you have to strengthen that, it is just like an exercise. You have to keep doing it and working at it and thinking well. It gets easier, you get stronger, but it's probably one of the most important things because it is that subconscious, that conscious that guides you in thinking well. So some healthy habits, you've probably heard these. These are not new things, but we're going to get to the bottom one you may not have heard about. But healthy habits that people do, they sleep well, which is a battle. It's a battle for lots of people. It's a battle for those. But if we're not sleeping well, our body has trouble repairing. Our body actually, when we sleep, our brains actually clean itself out. There's some things that happen in that sleep cycle that we need to happen. So if we're not sleeping well, we need to figure out why we're not sleeping well and do some things. There's some processes, and there's many reasons that people won't sleep well. One is when people watch the news and then they go to bed and then they harp on all this negativity. So probably if we're having trouble thinking about those things, take control of that thought process, especially before you go to sleep. Diet. We could talk about diet. You do classes and classes and classes and classes on different diets and different things and the importance of that, but that's a healthy habit. Exercise. Now, when I talk about exercise, sometimes it's just simply getting up, moving, walking around, and progressing to where you're increasing and moving those muscles and those types of stuff. But exercise is much, much more challenging now, it seems like, but we want to make sure that we're exercising physically, but also mentally. We want to exercise. We want to do some meditation. There's lots of resources out there. I'm not an expert at meditation. I'm working more and more on doing that, and it helps, but it's a process. It's something that will definitely benefit you. And the third thing is having a healthy functioning spine, because the spine is where the communication between your brain, that what we're working on to make that thing work well, your diet and everything, but it's the communication factor. Is everything in your body communicating optimally so that we can optimize our potential? So most people associate chiropractic with pain, which we're good at treating that. Most people think of, when we think about chiropractors, we think about, oh, I have a neck pain, back pain, all of these things, I need to go see the chiropractor, which is fine. It's great. Get results doing that. But there's more to it than the pain component. Pain component is actually one of the last things to show up when there's an issue. Now, when there's an injury, it shows up right away. But one of the last things that shows up when there's a problem is the pain component. And pain nerves, there's only about 10% of our nervous system that actually is anything to do with pain. The other 90% is all about function, communication, doing those things. If that 10% is being affected, almost guaranteed that the other 90% or part of those are being affected also. So chiropractic can address some of those other issues along with those pain issues. Yes, pain is a factor. Pain's a strong motivator for us to do anything. So the truth is, health's about proper communication. What are we telling our brain? What are we putting it in there? What are those signals? So this is actually a phone cord. Wouldn't you love to try and sort that thing out? But what happens if you see all these cords? What do you think happens if one of those gets disconnected? The whole thing doesn't stop working, but that connection, that communication to that one part doesn't communicate. Now I want to show you something that I found very interesting is this. This is actually a spinal cord and the nerves descending from the brain. So if you can look right there, the brain is right there at the base and it goes down. This is actually obviously a cadaver. But if you look all of those nerves coming out, those are communications, just like this is. This is you. This is a person, that communication system. If something interferes or decreases that body's ability to communicate, then we may start having issues with that particular part. And it may not be completely stop the communication, it may be decreased communication. So the better that our body can communicate, the more likely we are to be healthy. So here's some facts. The nervous system governs everything from basic functions, such as digestion and respiration, to cognitive functions, such as memory and intelligence. It determines our emotional responses. It detects changes in the internal and external environment, and it also collects and transmits information to the brain and the effector organs. So it's that master communicator. It's the way our body communicates is through that nervous system. Love facts. The nervous system is responsible for how we react to any situation, both emotionally and hormonally, as well as enzyme production and muscle contractions. So when we talk about pain, that's only 10%, but that nervous system is the communicator. So if we're having issues, there's something that's going on. That's why thought processes and how we think and taking control of this is so important, because what are you communicating with the rest of your body? And that's why it's so important that the spine and all of those allow for that proper communication so that we can have the ultimate health that we can have. I don't know if you knew this, 90% of the stimulation and nutrients to the brain is generated by the movement of the spine. As we move, our brain, it's how our brain gets nutrients. Our brain is a big user of energy. And we need motion, we need movement. We need to do those things for that spine to get that nutrients and get that thing moving for the brain, because what the fluid that goes in the brain comes down through the spinal cord and moves all of that around. So how do we care for spinal cord? This is where chiropractic comes in. Some of you may have been to a chiropractor, some of you may have not. But what is it that we do as chiropractic is we look at the spine for what's called a subluxation, something that may be interfering with the body's ability to communicate properly, with the body's ability to move information. But also, if there's a painful area, the body's telling us something in that particular area. But where there's pain doesn't always necessarily mean where the problem is. So that's where we do with chiropractic. So a specific chiropractic adjustment. So what do we mean by specific? In the spine, there's 26 vertebrae with two sides. And if there's a certain area, and I'm going to show you this in just a minute, where each of those things go, but a specific area that's located that we want to adjust for that particular area that's not moving well to get those things moving. So a specific chiropractic adjustment, what can it do? It can increase blood flow. It can move things better. It can help boost immune system. It can decrease inflammatory cytokines. That's your pain components. It can relieve muscle tension. So if something's not where it's supposed to be and we adjust it and it goes to that area, that's where it happens. It relieves those muscles, removes interference between them. That's the key right there. Removes the interference between the brain and the body. All because your brain can communicate better with the body. If your body can talk, your body knows what to do. Your body knows how to heal itself if we just help it. If we get things out of the way that's causing some of these issues, your body knows how to heal. When you cut yourself, there's nothing you can put a Band-Aid on it. You can put an antibiotic or something on that, but that body has to heal from the inside. It has to create that and then heals from the inside. Your body does all of the healing, and it knows how to do it if we just get it moving in the right direction. So this is kind of an example. This is the 90% or example of some of that 90%, where those nerves come from. We use what's called a Merrick chart for muscle tone derms, but we also look where does it go to? So if somebody's having breathing issues, heart issues, things like that, they may have issues in their upper spine. If they have lower issues down in the lumbar area, L3, L4, L5, which is right above, I wish I could point, I'm pointing to the thing. That could be where you're having bowel issues or something like that that's not working just right. It's not always about pain, it's about function. Now, pain is a great motivator. It's telling us something. Now, this was given at a health talk I did. This is actually a real, I say simple, but it's pretty complicated, but it's telling us a physiological aspect of what happens with what's called a specific chiropractic adjustment. Those emotional, physical traumas, chemical toxins, that misalignment, when we put that, what's called a subluxation, when we adjust that, this is what happens. Those communications take place. There's a test at the end of this, so I want you to memorize this really quick. No, just kidding. I put this out there when I teach my class, but there's all of these things, if you look, that can be affected by just that adjustment. When those things are happening, this is how that adjustment works. It's not about just a bone or a pain or a muscle or those kind of stuff. Yeah, we want you to feel better with the pain part of it, but we also want your body ultimately to heal better. So truthfully, and sometimes I offended some of my patients when I said, it's not as important to me that the pain goes away right away. We're going to do everything we can to get the pain to stop, but we want to give your body the chance to heal the best it can, and that takes a little bit of time. But we want to get it on the right direction. We want to get rid of what's called that interference or subluxation that's interfering with that process for your body to heal. So what does it do? We all know that what the spinal adjustments can do. It changes the way the muscles control. It's science found that lower back adjustments in asymptomatic, nobody has symptoms. They did a study on people. They give these individuals an adjustment in areas that they found what was called restrictions or subluxations, but they didn't have symptoms, meaning they didn't have pain. And it significantly influenced brain to spine communication and the reflex activity in the spinal cord, meaning that after they were adjusted, their body, the reflexes improved. They were able to function faster. They were able to do those processes better. And I'm going to show you another research that I really enjoyed, especially for our older population. One of the things we talk about with our older population is balance, and how do those things work with balance, and how is the proprioception of our feet and how those things work. One of the things most people don't know, that some chiropractors, including myself, we actually will adjust not just the spine, but we'll adjust the joints in the hands, feet, and all of those things, because those need to function well also. But how your body communicates. So here's an interesting, there was a 12-week study of a group receiving chiropractic care showing a significant improvement in ankle joint positioning sense, meaning this group, when they adjusted them, they found that they were able to sense where they were, and it gave them better balance. They were able to understand where their joints were as opposed to where they were not. Their body, their brain were communicating all the way down to their feet, which, as we know, reducing falls is so important. So one of the questions that comes up with people when they ask about chiropractic, well, why do I need more than one adjustment? Now, there are times when I've adjusted somebody and their pain instantly went away. But I like to use the orthodontist example. So you're going to put braces on your teeth. You go in. I don't know if any of you had braces. I've not. I've been around people that have, and it's not the most comfortable thing. So we put some braces on there. First on Tuesday, they tighten them all up. Would it make any sense to go back on Thursday and take those braces off? No, because it takes a while for your body to get back to the normal, to get back and for change to take place. So why more than one adjustment if there's no symptoms? Remember, if we're just treating symptoms, that's fine. But we want your body to function better. So there's typically a lot more than just one adjustment. I say a lot more. It depends on the person and how they hold that adjustment. Kids respond a lot faster than older adults like myself, because they haven't created a lot of these improper muscle patterns. They haven't sat desks and done all of those types of things. But if we really want to get our body functioning well, it takes time. It's kind of like going to the gym. Well, we'd like to all go to the gym, but if you went to the gym, and I like to use men as an example, New Year's Eve, we make a New Year's resolution that we're going to get in shape. So we don't go on the 1st because that's a holiday and we're usually trying to recover from the party. But on the 2nd, we're hitting that gym. And so we go in there and man, we're going to get it all done. So we're going to change our body completely. We exercise. We took pictures even because we want to see that change. So we go exercise 2, 3, 4 hours and we come and take a picture and there's no change. And we're disappointed. We wake up the next morning and we can't hardly move because our muscles are so tight, we can't move. And so we're so sore from our workout. So there's no way we're going back the next day. So we kind of delay and we wait another week or two because we're recovering. We remember what it was like. We look at ourselves and we don't see any change. But we go back one more time that month and we're very disappointed because we haven't seen any change. Well, it's because change takes time. If you start an exercise program or you start a dietary program or something like that, and we looked at ourselves every day, you would not see a daily change as much as you would if you did a 6-week, 8-week. We're measuring where you see that changes. But when it takes place, it's small increments. That's why if you really want to make changes chiropractically, that's why we need to actually put things together with the adjustment and some rehab and types of things like that so that we can actually affect the change so that your body will hold that and be effective. Anybody use a phone? This is probably one of the biggest health risks for, I would say, our youth, but for everybody. If you look at this diagram right here, the head weighs between 10 and 12 pounds. At the proper angle, that first one, there's 0 degrees, you have about 10 to 12 pounds of pressure on the neck. If you increase that anterior or forward movement, it puts now at just 15 degrees, now there's 27 pounds of weight or pressure at that area of that spine, and right in here. 30 degrees is 40, 50. So 60 pounds when you got those and you walk around, and I challenge you when you can get out, go look at a lot of our kids now, and you'll see these necks they're moving forward between 45 and 60 degrees, and the weight that's putting on that spine that's causing degenerative issues because it's like 60 pounds of pressure putting on that pressure right in here at that point. So it's very important that we get these adjusted, but we also start correcting that movement and that posture so that our body can hold those and we're not putting abnormal pressure. I had a patient that was a 12-year-old little girl that started having chronic headaches, started having these issues. We took an x-ray actually, and she has what's called degenerative disc visible at 12, which you normally wouldn't see in the 30s and 40s. It's not normal. It's common, but it's not a normal, healthy thing. But at a 12-year-old, it's because they're sitting there doing this, they're leaning forward, that kind of stuff. So giving yourself that chance. Now, I'm going to use an example because we talk about not knowing what goes into our body or not being aware of it. So if you sit forward, I'm going to tilt this down just a little bit, and you've got your hands back, your head back, and if you're with me, kind of do it, and you breathe in. And that felt good. Let's do it again. Now, bring that phone ahead. Roll your shoulder forward, lean forward, and take that same breath. It's so decreased. It's decreased 30 to 40% of oxygen can be decreased. It's getting into our bodies, and we don't even know it. Our body, we're not breathing enough oxygen for our body to function properly by these simple things right here. So we need to correct this and be aware of our posture and be aware of where we're breathing, so that our body, because if we're not breathing enough, we're decreasing our body's ability to heal. So here's a few things people aren't always aware of that with chiropractic care that they can do. Most people know, low back, neck pain, those kind of things, but most people aren't aware that pregnancy discomfort, or even before, helping a woman as before she gets pregnant, birth trauma. There's a study done that shows that 97, I think it's 97, between 95 and 97% of children that are born, regardless if it's a vaginal birth or C-section, suffer some type of birth trauma, microtrauma, something like that, which by definition, what is that? That means it decreases the ability for whatever that part is. Now, extreme birth trauma would be cerebral palsy, and that affects our muscles down here. This is that communication we're talking about, but the problem's up here where that trauma is. So having a baby checked, and we don't adjust as well, it's a real gentle adjustment, but just having them checked to make sure that those things that their body's able to heal and they're able to develop. So that goes with colic, constipation. Text neck was what we talked about there. Headaches. Chiropractic's known to help with a lot of different type of headaches. Obviously, there are some types of headaches that we don't, because they're caused by something that's beyond the neuromuscular aspect of it. But many times, if we can get that person functioning better, and then we can address some other things, those headaches can be decreased or eliminated, at least partially. Overall wellness, that's where we want to get. We want to get past symptomatic-based health. We want to get past feeling like, oh, here we are, we're down, all of that. And then, okay, what's my goal? Okay, let's take those steps. And it is steps. We've got to be patient with ourselves. We've got to be to that process where we're moving forward in that area. So a healthy body combined with a healthy mind can allow us to live longer and more full lives. And I will argue that it's actually living. When we can actually get our minds and our bodies in connection and move forward. And it's not easy, I understand that. Our health does not affect us, it affects everyone we love and care about. Remember when I talked about putting that mask on first for you? It's not selfish to take care of yourself. It's not selfish to get yourself healthy. It's not selfish. It's actually very, very giving, because if you don't have your health and you don't work on yourself, then there's nothing for you to give. You must not think that you're selfish for taking care of your health. It's actually a very, very important thing and very giving thing to do. So we've gone through all of these. What are these things that we need to do when it comes to our health? And many of you have heard this before, but what is it? You need to find out where you are. And it's time. Let's be real. Let's be honest with ourselves and do a self-evaluation. And it can't just be, do I have symptoms or no symptoms? What's my self-evaluation look like? And then where do I want to be? Most of this takes place in the mind first, and then we start going from there. So then chiropractically, when they come in, if somebody knows where they want to be and what's their barriers or those kind of things, then we want to do the exam. We want to measure it. We want to get through where we want to do, and we want to get together and make sure we're on the same page so that we have the same goals. So you find out where you want to be. You cannot get someplace without a purpose. You cannot get someplace without taking steps towards a purpose. Without goals, we don't accomplish anything. You got to make a choice. It's a conscious choice. Again, I go back to the mind. Everything in our body health-wise goes back to the mind. Take the steps necessary to get there. So there's lots of people out there, motivational and all of those things. But until we actually start getting our mind oriented with the steps we need to go, we will never get there. It's like having a rudderless ship that sends out. We need to know and we need to map it out. And how are we going to measure it? So remember, potential doesn't matter. It's realized potential. How do you release your potential? We make choices every day that will help realize our potential. We don't have to be perfect, nor can we be. We just need to move in the right direction and keep going. And here's the big thing. We beat ourselves up if we get off track, or something gets in our way, or something unexpected, something like that. We've got to stop doing that. It's just part of the process. When we get off track, we have to get back on and we have to move forward. We have to adapt and move forward. That's the key. Adaptability is one of the most important things of survival of anything. So I have one last question just for you before I open up for questions. And this is, if you don't take care of your body, where are you going to live? It's a choice. Remember, there's 3 parts to a healthy person. They move well, they think well, and they eat well. And the think well has to be the guide, because the other 2 will not be sustainable if we don't start concentrating on that part. If our body, and when it comes to chiropractic, if we do not get our mind communicating and then releasing our potential through our body, we will never get where we want to go. So I'm going to open up for any questions. I put my contact. You guys can email me questions, or we can answer questions here. Anybody, I appreciate the time. And if you would like to